If you have any anxiety about going through IVF, make sure you watch this video. Hi, I'm Dr. Serene Lim. I'm an obstetrician and gynecologist as well as a fertility specialist. I'm from SWC Serene Fertility and Women's Clinic at Gleneagles Medical Center. IVF essentially stands for In-vitro Fertilisation. It's a procedure where eggs are combined with sperm in the laboratory, and these fertilized eggs are implanted into the womb to potentially get the woman pregnant. IVF has the highest success rate compared to other infertility treatments. The first IVF baby was born in 1978, and since then, more than 8 million babies have been born through IVF. Currently, worldwide, about 2.5 million IVF cycles are performed every year, resulting in the births of 500,000 babies a year. IVF can help women with endometriosis, which is a condition where tissue that is similar to the lining of the womb is found outside of the womb, causing scarring and inflammation. It can also help women with polycystic ovaries, where hormonal imbalance occurs, resulting in problems with ovulation or releasing of a mature egg. IVF can also help women with blocked tubes or damaged tubes. In fact, the tubes are where the sperm and the egg meet in the body. And essentially what IVF does is to bypass the tubes altogether, because in IVF, the sperm and the egg meet in the laboratory. So IVF is a very ideal treatment for women with damaged fallopian tubes. IVF can also help males with infertility issues like low sperm counts and also sexual dysfunction. A form of IVF called ICSI, or intracytoplasmic sperm injection, is where in the lab, the sperm is pushed directly into the egg, and this can help men with a low sperm count. Some couples with what we call unexplained infertility can also benefit from IVF. Unexplained infertility is a condition where the cause of the infertility is not very obvious, not because there is no cause, but because the cause has not been diagnosed by standard infertility tests. So what IVF does is that it can help some of these couples get pregnant, and it can even help to diagnose the issue in a certain number of patients. IVF can also help couples who have tried but failed to get pregnant with other forms of infertility treatment, such as IUI or artificial insemination. The success rate of IVF does decline with age, especially that of the female partner. This has to do with lower egg count as well as poorer egg quality in women of increasing age. Hence, the ideal candidate for IVF is someone who is relatively healthy and is able to give us healthy, good quality eggs. Usually what I'll tell my patients is that what they go through for IVF is an exaggerated version of what they go through in a normal menstrual cycle. At any point of time in the normal menstrual cycle in the ovaries, most of the eggs are immature. In other words, they cannot be used for fertilization. In women with regular periods, at the start of a normal menstrual cycle, the brain produces signaling hormones to stimulate a small number of follicles or little sacs in the ovaries that contain eggs to develop to the mature stage. Usually in a normal menstrual cycle, the brain produces just enough signaling hormones to get 1 and occasionally 2 follicles to develop to the mature stage. What we do for IVF is that we give these signaling hormones, but in much higher doses, so that we can stimulate the development of 10 to 20 follicles to develop to the mature stage. Eventually, we will be collecting eggs from these mature follicles. So this is what we call ovarian stimulation, and it takes about 10 to 14 days, similar to what happens in a normal menstrual cycle. During this time, your doctor will be monitoring your follicular development with scans and blood tests. Now we go on to the second phase, which is a procedure called oocyte retrieval or egg collection. Oocyte retrieval is performed under sedation, so you will not feel any pain during the procedure. What your doctor does is that he will pass a thin needle through the vagina to collect your eggs. So the procedure is done transvaginally, which means that there will not be any surgical incisions on the tummy, not like what happens for standard surgeries. After the procedure, you might feel a little discomfort in the tummy, and this is usually relieved by painkillers. After the eggs are collected, they are fertilized with your partner's sperm in the laboratory, following which your doctor would then either perform what we call an embryo transfer, or he might choose to freeze these embryos or fertilized eggs, depending on your condition. The embryo transfer is a much simpler procedure compared to the egg retrieval. The embryo transfer usually does not require any sedation. You'll be asked to drink a few glasses of water to fill up your bladder. This will help your doctor to visualize your womb properly and also to straighten out your womb so as to ensure a smooth transfer. What your doctor will do firstly is that he will put a small instrument in your vagina to help him to visualize your cervix, which is the entrance to the womb. After that, he will put the embryos in a small catheter which will be placed into your womb to deposit the embryos. If your doctor feels that the embryos should be frozen, he or she will ask you to come back in another cycle to put back the embryos. First, he will give you some medications to prepare your lining. Alternatively, he will monitor you during your natural cycle with scans and blood tests to determine an appropriate time to put in the embryos. One of the common risks related to IVF would be that of ovarian hyperstimulation syndrome, or OHSS. This is a condition which is characterized by enlarged ovaries and accumulation of fluid in the tummy. A mild form of OHSS occurs in about 10 to 20% of IVF cycles, where the woman has mild abdominal bloatedness and discomfort. This usually resolves on its own after a few days. About 1% of women may have a serious form of OHSS, where large amounts of fluid collect in the abdomen as well as in the chest cavity, resulting in severe pain and breathlessness, as well as dehydration. These women will usually require hospitalization. Thankfully, the incidence of OHSS has declined in recent years because of improvements in assisted reproductive technology. Other complications related to IVF are very uncommon, and this will include complications related to the egg collection procedure, such as bleeding, infection, and a very rare chance of bowel injury. I would suggest that both husband and wife try to eat a healthy diet. Try to focus on eating a diet which is rich in antioxidants, so lots of fruits and vegetables, which will help in improving sperm as well as egg quality. Also, try to eat more whole foods. For example, whole grains, beans and nuts, low-fat milk, eggs, as well as lean meats such as protein and fish. Try to cut down on your intake of processed foods, saturated fats, as well as refined sugars. Secondly, try to maintain a healthy weight. Being overweight and underweight are associated with a higher chance of miscarriages. It has been shown that women who are obese have poorer outcomes when they do IVF cycles. They require higher doses of IVF medications, and they also have fewer eggs collected at egg retrieval. Heavy drinking is also associated with reduced chances of success with IVF treatment. Too much alcohol is also harmful to the development of your unborn baby. I would also suggest that you read up a little bit before starting your IVF cycle, so you get a mental preparation of what is going to happen. So this might alleviate some of your anxiety regarding IVF.